Okay, I'm back, y'all. With another topic. I'm in a restaurant. You know I have to record where I can record at because now it's been some rules that's been said. I don't want to disclose them here, but it's some strict rules now. And it's places that I can record and I can't record. So I'm here in a safe place that I can record, and it's copyright rules, so hopefully my videos don't get struck down. But I'm here in Longhorn recording my video. Like I said, we only have 3 hour passes, so I'm trying to record content as quickly as I can. It's not going to be a long video, so I'm just telling you basically the real deal. Holyfield, living in a mental hospital is fucking horrible. And I'm just going to go down with some bullet points that I have. It's like a little PowerPoint presentation that I have with you guys. The food is trash. Imagine being in a hospital for 3 years, and some people have been there for like 20 years. They said it used to be good, but just imagine being there now from this point and having soggy hash brown Tuesday, every Tuesday for the rest of the Tuesdays that you got. You got a curfew, you got to be in at 10 o'clock, and then during a week you can't be out. You got 3 hours to be out during the weekend, and if you don't have a job, you just going to PSR. You got a good cook now, but if she leaves, then people don't know what they're doing with them seasonings. I cook now, Laura. She is Lauren. I always get her name mixed up. Is it Laura? Or I think her name is Laura. I worked with her in the kitchen. She is really good. She can really cook. That last Thanksgiving that we had, she really made some really good dressing. They call codes every 5 seconds. So in the middle of the night, we got a building. 2, they off the chain over there. They civic patients coming from jail transfers, so they know they going back to jail. They loud over here at this table, so I hope y'all can hear me. They know they going back to jail. So they be fighting over there. And all night they call it cold white. That's like a fighting cold. Cold green is like when a patient hasn't escaped. A cold silver, I think that's when not silver, something when they have a weapon. I don't know what all the codes are, but they call it codes all day and night long. They do checks throughout the days and nights where they're checking on you, 15-minute checks, and they're snatching the doors open, and then they pushing the doors open and snatching them closed. And I don't have like any buffers on my door, so they like snatching them open and closed. One day I had to jump out of my bed like, sis, what are you trying to do? You trying to give me a panic attack in the middle of my sleep? Because what is happening right now? No regards to like you sleeping. It's crazy. They hire anybody off the streets now. It's like they getting desperate for staff, so they just hiring anybody off the streets and not properly training them. It's like you at least need to be hiring Chick-fil-A staff, because at least they know how to say please and thank you. They have manners and they're courteous over there. Staff exploiting patients, they having sex with them, and and you just lose control over your entire life. This probably gonna be less than a 10-minute video, and I'm okay with that because I'm here to give you my journey. I'm here to give you my truths, and I'm here so we can all look back and see where I came from, because we know I'm not gonna be in this place forever. And when I say, let me expound on, they hire anybody off the streets. I had a girl tell me her name. I'm not going to tell you what her name is, but I mispronounced her name. And she was like, oh, that makes me so angry. I hate when people call me that. It makes me want to punch them in their face. I had to just stop and think to myself, like, I said, you don't talk to patients like that. You know, if you catch the right patient, you will lose your job. Do you value your job? And she was mad. What you mad for, girl? You don't talk to patients like that? How old are you? 24? Okay, well, If you want to keep working and you don't want your own business, you need to learn how to talk to people. Punch them in their face. Because if you punch me in my face at any point, you're gonna get fired and you're gonna get your ass whooped, and you're gonna take home an ass whooping, and you're gonna be in the unemployment line. And then they have what you call a privileging process here. That's where they give you privileges. So you have to work your way out of the hospital. So first it is, you can walk, you have to stay on, you can walk over to the building with staff, over to building 2 from building 1 with staff. And then you're able to go in the community with staff that's in whatever community with staff, and then you can go on grounds by yourself. Usually they lump those 3 together sometimes, if you're lucky. And then after that you get what they call 4s and 12s, that's unescorted community, which is what I have now, which took me 3 years. Some people, it takes 1.5 years to get there. And then they're out of the hospital in 2 years. They drugged me, I don't know why. Maybe because I got Blue Cross Blue Shield Federal. Girl, I don't know what this eyelash right here doing. These stick-on eyelashes, by the way, you just take them off the pack. They're called Lily Lashes. And it's not sponsored. I just like sharing with my ladies because I like my ladies to look good, effortlessly. And you just like stick them right on top of your lash line. Anyway, what was I saying? So, and they usually work good if you can get them right on your lash line. And I've been trying to pull it down. See, there you go. There you go. I think, whatever, we ain't gonna worry about it. It's on there now. I'm out. And then after that, you get 48. That's getting you 48 hours out of the hospital into the placement that you'll be in, which is like a group home placement. So you'll be in that group home placement, and that's the transition home you'll be in once you get placed on your conditional release. The conditional release is usually what they put you on is like a probationary period, which can be a year or however long they have you on there, proving yourself that you can take your medication, go to whatever plan they have you put on, whether it be groups, whether it be therapy, until you can get out of the hospital. And once you're off of conditional release, you're free to go. One guy got unconditional release, but now they've given me another diagnosis. What did they give me? What's the diagnosis they give me now? Yeah, hold on, I gotta think. Borderline personality disorder. And I spoke to a young lady just recently here at Longhorn, which God has just put people in your life miraculously. And she's like, we were just talking, just having a conversation about mental illness, and she was like, I said, I'm bipolar. She was like, I'm borderline personality disorder. And I said, do you mind me asking, how did they diagnose you that? And she was telling me the story on how, and I'm like, that don't sound like me at all. But I've been reading The Art of War, so we're gonna go along with it. That's how we're gonna do that. And then I'm gonna get a second opinion when I get out the hospital, because I don't want that on me. But she sound like it. Plus she a Cancer, you know cancers are, you know how what they say about Cancer, they extra soft. I'm no Cancer. But I'm done, y'all. I'm done talking to y'all. Thanks for watching my video. And if you're following my journey, continue to follow my journey. I appreciate you guys for your support. And give me a thumbs up. Follow my channel and share this with your friends. Love you guys, and I appreciate your support. Bye-bye. And my next video should be an interesting topic. I'm gonna keep y'all guessing, and then we'll talk about this diagnosis that they gave me. I'm not gonna talk to my psychologist until next week, so we'll talk about what they got to say about this borderline personality disorder. Talking about I seek attention. Well, if I do, it's because I got attention my entire life. But I guess. All right. I think they gave me a Scantron test, and one of the questions they asked, and I answered, what do you think you're extraordinary? I said I'm an extraordinary individual. I remember asking it. And then I looked at another one and they said, are you an ordinary individual? No, I'm extraordinary. What the fuck? All right. You should think you're extraordinary too. All right, y'all. Y'all have a good day. Thanks for watching again. And look at this cake that I'm telling y'all I'm losing weight. My face keeps going up and down, but for real, this time I'm gonna do my fast. Look at this. Chin keep getting big and small. The struggle is real. And I'm so sick of looking at this lash on the left side. It's stressing me out so bad. That don't make no sense. Don't look like, who told me to get that? And I ain't eating no more. I just had a whole steak. Alright, y'all, I'm for real. I'm gone. That's my last meal this week. I'm done. For real this time. Alright, bye.